Hi, I'm Dr. Patrick Andersen of Madison Maximized Living. Did you know there are about 10 million motor vehicle accidents and 3 million whiplash injuries each year in the United States? Up to half of those people can have chronic pain and dysfunction lasting years or even permanently. With 1 in 3 people having neck pain on a daily basis, injuries from whiplash account for a significant portion of chronic neck pain in the United States. Stay tuned as co-host Stacy Hansen and myself help you understand whiplash. Coming up next.
Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking whiplash today. So Dr. Pat, what is whiplash? A lot of people think that they know what it is, but why don't you give us your expert opinion?
Well, it's an injury. It's a name that isn't well understood. It's an injury, a fairly complex injury, where the body is actually accelerated and decelerated very quickly. So with a force, the thorax is accelerated forward, then the neck extends very quickly and shrinks about an inch in about 0.4 of a second. And then It causes significant problems. And there's about 70 million people with neck pain today in the United States will complain today, my neck is bothering me. And there's about 10 million new car accidents every year. Not all of them cause significant injury, but about 3 million people a year get a whiplash injury. And they're often chronic. And so there's about 20 million people who still today have neck pain, and their neck doesn't function right from a whiplash injury.
And they're not necessarily relating this to their accident that they maybe had years ago?
Right, and it's so much like their neck is sprung like a spring. I like to use my little prop here, a slinky. You remember these would go down the stairs just perfectly, and then after a while something would happen to the slinky, and then it wouldn't work. There was a bad section in that slinky and it didn't work there anymore. So when it hit that bad section, it would stop working. And that's kind of what happens with the neck. The neck is complex with ligaments and muscles and certain curves and alignment necessary. And when that neck is ripped so hard, it springs it like a spring. And it doesn't function right. The capsular ligaments get injured, the motion patterns aren't the same, head goes forward, loss of curve, and that leads to problems.
Wow, so it's something that so many people, 20 million people have. So you hear a lot of people talking about whiplash just in conversation. What are some of the negative connotations that people have when they hear that?
Well, they think they're doing it, they're just claiming it so they can get a big settlement, but there really aren't big settlements out there, not very many. And so it doesn't work out that well that way for financially. And plus that was disproven as a real motivator that most people, 2 years afterwards, their settlement still complained of neck pain. It wasn't about getting a settlement. So that's one of the negative connotations. Plus, it's just not understood. Everyone thinks, oh, you get injured, it's supposed to be better shortly. Well, when you whip the neck that fast, it damages tissues and it doesn't get better that fast. It takes time. And a lot of injury often can happen with very little car crush. You think the more the car is hit, the harder the collision, the more injury. But in whiplash, it's different.
Oh, really?
Because the forces are reflected into the patient, into the occupant, and if the car doesn't crush, the bumpers absorb and reflect that force. But if the car crushes, there's a lot of absorption of forces and the occupant doesn't take as much injury.
Oh, that makes sense because people always think, wow, look at this car, you know, look at how damaged I must be, but that's not the case.
Right. So actually, if the car was stuck in cement, imagine driving onto wet cement and your car got stuck there, and the next day someone came along and rear-ended you, the car would be completely demolished. But the occupant wouldn't necessarily be hurt because their car didn't get accelerated.
Oh, wow.
Yeah, so, but there isn't really a direct relationship between the car crush and the injury. And people think, oh, it was a light injury, so I couldn't have got hurt too bad. So they must be faking it. But in actuality, most whiplash injuries occur 8 to 15 miles an hour.
Wow, so you never really know. Definitely get yourself checked out then if you've had some kind of minor accident.
Exactly. You just don't know. And one of the other things is you don't necessarily feel the pain right away. There can be a delayed response. Now, most people will feel it fairly quickly or get headaches right away, but there can be a delayed response where you don't feel it for a week or 2 weeks and then something goes haywire with your neck, sometimes even longer.
Oh, wow. Well, stay with us. We have so much more to talk about on whiplash right after the break. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking whiplash today. So let me ask you about rear end collisions, because it seems to me that that's probably one of the more common ones. What kinds of injuries are you seeing with those?
Well, there's the rear end collision where the thorax gets accelerated so quickly and the neck extends, and in 4/10 of a second you can take 10 Gs.
Wow.
And it takes a half a second for your muscles to respond, so it all happens before you can hardly even respond. But side collisions are actually really difficult too, because there's not a lot stopping the head from tipping the shoulder. But it's very easy to get seriously injured or even killed in a side injury because there's not restraint. And then the front end collisions are different. But in the rear end collision, there's so much acceleration so quickly, and we look at 4 sites of injury. One being obviously the neck. Number 2, the lower back is commonly injured. About 6 out of 10 times the lower back is injured if you've injured your neck too.
Wow.
And thirdly, the jaw joint has its own axis of rotation, and it can be very quickly opened in a collision and injure the jaw joint. So that's the third site of concern, is TMJ injury.
Oh, wow.
And the fourth site is the brain. Over half of people involved in a whiplash have a concussion. So it's the brain hitting the inside of the skull with such a rapid force, and that'll cause often a lot of different symptoms with blurred vision and dizziness.
Yikes, so there's so much more to it. I mean, I never would have thought about the jaw.
We're dealing with a sensitive nervous system, bone on soft tissue.
So what are some of the signs and symptoms of having whiplash, in case someone's out there watching thinking, wow, I think I might have this?
Well, obviously neck pain, concussion, headaches, blurred vision, weakness, head heaviness, inability to sleep, double vision. It can change your taste. You can have poor concentration is real common. You can have radiculitis, or pain running all the way down the arm. That's about 6 or 7 out of 10 will have that, and that's more serious. Nausea, numbness. You can be very irritable, changes in behavior. So there's all kinds of things that go along with that kind of injury.
Again, wow, I'm just amazed. There's so much more to it. People could be trying to diagnose themselves and thinking all sorts of different things, and here it's whiplash. So let's talk about these motor vehicle accidents again. What are some of the factors that make it so someone gets hurt actually worse?
Yeah. One of the biggest reasons people get hurt worse is they're unaware of the accident. So if you're aware, you have a chance to brace and protect yourself. And you always hear the adage, well, if someone was inebriated and they rolled their car over, and because they relaxed when they were rolling over it, they didn't get hurt.
So that's not true?
That is complete myth.
So don't
So
relax.
here's an example. If you relax your wrist and flap it as hard as you can, you don't want to do it very hard.
No.
You would hurt your wrist.
Yeah.
But if you make a fist and flap your wrist,
It doesn't flap very much.
it's not going to get hurt. So there's a protection mechanism when you brace. So being aware of the accident, not being turned at the time of the accident, because you have about half the extensibility of your neck without injury if you're turned. Now, having your foot on the brake, when you want to control injury, the way you would control injury is control acceleration. So when your foot on the brake, you're not going to be able, it's like your car in cement, you're not going to be able to get accelerated fast. So if you control acceleration, you usually will control the injury.
Oh, so is that true too if you're not going as fast, like to begin with? Oh, okay.
Yeah, so if you're rolling along, that's more dangerous than being stopped with the foot on the brake, because you can't accelerate your car. It's all about accelerations.
So interesting, so much I didn't know. So anything else on that, or is
Well,
that...
having that head restraint close to your head, and a lot of our seats now have that built in.
Yeah.
So you want to keep your head within 2 inches of the back, because the more you allow extension, the more you get hurt. And that's what's so hard when we see these classic cars. I see people driving around with no headrest at all, and they're just propped up there, and it's a little scary to see, because it won't take much to hurt your neck when you don't have that head restraint.
So that's what that headrest was all about.
Yeah.
It's not just our comfort.
And then actually, this is interesting, a seatbelt actually causes injury in rear end collisions. Now, obviously you need to wear your seatbelt, but in a rear end collision, your head is extended backwards very quickly as the thorax goes forward, and then there's a reflex pulling of the front of the muscles forward, and then you turn around the seatbelt. It adds a rotational component to it, and so that can actually increase injury 2 to 3 times.
Which can't be good. Oh, well, we've got to go to break, but we've got so much more to talk about. Stay right here. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about whiplash today, and we've learned some surprising things already that I didn't know. There's a lot of myths out there. So if someone does get whiplash, how long does this really take to get over it?
Well, to understand it, there's really 3 phases of repair. One is the acute inflammatory phase, lasts about 3 days. That's where your body's dealing with the injury and cleaning up debris and damaged tissue. The second phase is the regenerative phase. That takes from anywhere from 3 days to 8 weeks, where new amorphous tissue, collagen, is laid down in a matrix to heal the area. But that's after 8 weeks, that's usually done. And then from 8 weeks to a year or more, active care, adjustments, exercise help realign the collagen fibers along the tensile lines of force. And that's where it becomes functional tissue again, rather than scar tissue. So it's really important to go through those 3 phases of repair. And many people don't, and they're stuck with more scar tissue and dysfunctional tissue.
Because this isn't a quick thing. I mean, we're talking a year here.
Ligament repair, ligaments don't repair as fast as muscles.
So what are some of the things you find in physical exams for people?
Right, well, in a physical exam, we'll often see bad posture, head goes forward with the loss of the curve. We'll see weak muscles. Head heaviness is real common. It just can't sit up very long, get tired. We'll see a limited range of motion where a person can't turn their head fully or especially extend their head without pain. So that's a common finding. There'll be trigger points, a lot of tender muscles along the lateral cervical muscles or the base of the skull. Loss of reflexes, changes in skin sensation when we use pinwheels to see if all the nerves in the arms work properly. So there's really a lot of findings.
And now this can sometimes be a permanent disability. Can you tell if somebody's going to be having this more permanently usually?
Yeah, the worse they come in, the more degeneration they have, the older they are. If they have pre-degenerative joint disease, if they have that pre-existing, they're more likely to have more injury. If they come in with arm pain, that's more serious and more likely to have a permanent injury. And the studies vary from as low as 17% to 60% could have permanent injury from a whiplash injury.
So we've got this x-ray up here. Can we take a look at some of these, maybe normal and abnormal?
This is a whiplash patient.
Okay.
And so we do quite an extensive x-ray measuring series. And what you see on this person is there's forward head posture. We see a loss of the normal curve. It's actually minus 10 degrees versus the normal 43-degree arc that should be there,
wow, that's quite
which absorbs
difference.
Forces properly. So this individual's neck completely buckled. We also see degenerative changes here where there's spurring of the vertebra that pushes back into the spinal cord, often causing pain. And then we see a lack of normal, if we did flexion and extension x-rays, we'll see a lack of normal movement where these don't they stay stuck together, they don't bend, flex, and extend properly, and that causes serious problems. When we look at the skull here, a certain measurement we do, the skull should be at an 18-degree angle off of a measurement here off C2. So 18-degree measure here. The first vertebra is 18 degrees, and that's normal, but the skull is at 40. These two lines should be together. So what this means is the skull is extending on that spinal cord and compressing it, and that'll affect the anterior cord function, the front of the cord. But then the C2, that should be 0 to 10 degrees, and in this individual it's 37 degrees.
Wow.
So that spinal cord is literally getting strained this way from the skull and this way from C2.
Ouch.
And so it really affects function and pain and circulation. So even here, when you look, one of the things we always look at is that space between the skull and the first vertebra. These should be equal. So there's quite a difference here. So that really interferes with normal brainstem function when we have that abnormal structure. So abnormal structure causes abnormal function. And the likelihood of damage from it 5 years later is fairly high. Arthritis starts to happen after having an injury like this.
Well, that really shed some light on it too, just to see it like that. Well, when we come back, we're going to do some rehabilitation exercises to see how you can get better. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking whiplash today, and we're ready to do some rehabilitation exercises to show you how you can get better. So I'm willing to be your guinea pig for these.
All right. And of course, these make sure you have permission from your doctor, or treating physician, or chiropractor, hopefully, to do these and get you started at the right phase. First one we want to do is range of motion exercises.
Okay.
So on that one, passive range is to flex and extend your head as far as you can comfortably. Stop any point it hurts.
Okay.
Good. Good. We'll just do a couple of them. And then the next one would be turning. Turn left and right. And typically we do maybe 20 reps of these.
Okay.
All right. And then a lateral tilt of the head. This one will be a little more complex. You just tilt as far as you can each way comfortably. Now we're not looking for speed like we do on our other warm-up exercises. We're just looking for getting some motion in the area. All right. Next one would be isometric, the next level of effort. And for that one, we push against, you'd use your hand to push against it. Not too hard, you don't want to strain yourself at all. It's really quite light.
I don't want to hurt you, Dr. Pat, with my strong
And then
muscles.
that side, and then forward, and then backwards.
Probably doesn't look like much on TV.
But you don't want to push too hard, but you want to activate those muscles. The next one is a neck extension exercise. It's one of my favorite all-time exercises because people slouch so much. And so we'll put the hands behind the head fairly high, elbows close together, and then stretch the chin and elbows to the ceiling and hold for about a count of 5.
That's a nice stretch.
Yeah, you feel that all the way down your back, but it's really helping to rehabilitate the normal curve in the neck. Now for the more fun ones, let's have you lie on your back.
I don't know if I like the way you say fun. Something tells me it's going to be hard.
The next one is simple raising of your head.
Okay.
1 inch high, 1 inch head suspension. And just stay there for the remainder of this set.
Yeah,
we'll see how you do.
That gets pretty hard.
So you can start with 15 seconds and work your way up to maybe a minute or so. It's really a great exercise.
You really feel it pretty fast, yeah.
Now even better yet is what we call a 4-way neck exercise. When I particularly find this helpful in rehabilitating the neck when there's injuries. It's a very slow movement to get muscles working. So what we want you to do is scoot way up high.
Okay.
Way, way, way up high, just so your shoulders are almost off the bench. Way up.
Try not to slide off the entire bench here.
Yeah. And then let your head go all the way down.
Okay.
And then very slowly raise your head all the way up. Come on. It takes effort. And come up as high as you can with your head. There you go. And then we'll have you lay on your side. And we'll do 4 to 8 reps of that. You're typically starting. And this one, you tuck your shoulder down a little bit on the bottom.
Okay.
And keeping your head like that. You tip all the way down, and then you raise all the way up. Obviously, only through a pain-free range of motion. But it really works and rehabilitates, letting the muscles take over for where the injury is in the joint and the ligaments.
Okay.
They can give you a lot of support. Okay, and then we do that on the other side. But for this time, we'll go on your stomach.
Okay.
And this way, flex your head all the way down, completely relax. It should actually feel good, the weight of the head opening the neck. And then raise your head up and try to look ahead like a wall. Raise that up as high as you can.
Yeah, some of these seem easier than others. I suppose it really depends.
Yeah, it depends on your injury and what's going on for you. But the secret with this is going slow enough. Your neck can wobble, your head can wobble, and you might feel like you're skipping. So you try to go as smoothly as you can. Great. And let's have you sit up. And one of the things we also do is use a head weight.
Oh, I remember this. We've done this before.
Yes. And go ahead and stand up and turn this way. And the weight in front here is going to cause her head to pull back, and it's going to help change her posture subconsciously.
Yeah, you try to balance it
that
a
off.
little bit.
And then there's the cervical wall traction, where we put this behind your head like this. We'll go ahead and stay sideways. And this hooks up to a door, and she'll actually bend her knees and dip down, and that will distract the head, opening up the joint spaces. And it's just like a 1-second dip. So you go down, up, down.
It looks horribly dangerous, but it actually feels fine. It's a nice stretch.
Yeah, but only use such specialized equipment like this to do that. And then lastly, we use rolls under the neck and back. The large one under the neck, the small one under the back while you're lying down to mold a normal curve.
All right, well, stay with us. We have more on whiplash right after this.
Thank you for watching our show, Understanding Whiplash. As you can see, there are many considerations and complications involved in a motor vehicle accident. In our society, chronic pain is often treated with pain medication. There are, however, natural alternatives with gentle, natural chiropractic care. We help get to the cause of neck and whiplash pain. If you or someone you know has chronic neck pain or has possibly suffered a whiplash injury, give our office a call at 608-833-1282 for an evaluation. For Maximize Living, I'm Dr. Patrick Andersen. Until next time, live well and God bless.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Email Dr. Pat at cw57.tv.